Welcome, I'm Dr. Ludmila Schaefer, a host of the passion-driven platform on health, innovation, and motivation. And if you have health-related story or medical expertise, it's time for you to be on the Doctor Connect show. I am super excited because if you love skincare and beauty, you will hear our conversation with a board-certified dermatologist, Dr. Mary Alice Mina. I met with a very special guest, Dr. Erkeda DeRowan, a triple board-certified family, diversity, and lifestyle medicine physician who is combining human aspects of medicine with technology. I met earlier with Dr. Diana Londono, a board-certified urologist. Her expertise on medical and surgical treatment of pelvic organs, and she's a certified life coach that helps with physician wellness and directly relates to patient care. If you have a story to share or you have medical expertise, go to the website, thedoctorconnect.com, and click the button, Show Me How, and we will connect with you or send a message on social media. Stay tuned as we have new book coming on a collection of stories written by expert physicians in artificial intelligence to help you navigate through healthcare. And you will find our show on abc15.com. Let's welcome a very special guest, Dr. Mary Alice Mina. She is a Harvard-trained, double board-certified dermatologist and dermatologic surgeon, practicing for over 10 years. And she is a host of skin-focused podcast, The Skin Real, to help you with a real look at skincare and beauty from a perspective of true experts. Welcome, Dr. Mina. We are so excited to have you on our show.
Thank you for having me, Dr. Schaefer.
Absolutely. I can't wait to learn about skin. In fact, just before we started our interview, I was trying to fix my skin so I look good, and I just could not make it happen. And I know many of us so stressed out about our skin, our appearance, and it's so valuable to have you as an expert, as someone taking care of patients and community day in and day out. Dr. Mina, please tell us about yourself.
Well, thanks so much for having me. I think your skin looks great, by the way. I am a board-certified dermatologist. I'm actually a double board-certified dermatologist and dermatologic surgeon. And my area of expertise is really on the procedural needs of patients' skin. So that means I treat a lot of skin cancers, a lot of cysts, lipomas, and I also do a lot of cosmetic and aesthetic procedures to help patients look and feel their best. So it definitely can be overwhelming for patients, for friends, family, even for myself. Sometimes I get overwhelmed. And I am really a believer in less is more and skin minimalism. So just like we are talking about paring down our lives and decluttering, I think we also need to do that with our skincare. That we don't need a ton of stuff. And in fact, I think that actually backfires and makes our skin worse.
Why did you become, dermatologist? Why it's even important?
Well, I think when I first decided to go into medicine, just this light bulb went off that said, I want to be a doctor and I want to be a dermatologist. And perhaps it's because I really had some experience seeing a dermatologist when I was a teenager with acne. And I remember how devastating it was, how insecure it made me feel. And I was embarrassed to put myself out in public, to be seen. And my acne wasn't even all that bad in comparison to what some people deal with. But I just remember how that affected me so much in those teenage years. And I thought, if I can help someone with their skin and make them feel better and more confident, then that's the field I want to be in. I will give you my 3 or 4 step secret to great skin. And I think you'll be surprised. It's not complicated. But first and foremost, I would make sure you're getting good information from someone who is a board certified dermatologist, someone who has spent years, decades studying the skin and really knows what they're talking about. So that'd be first and foremost. Secondly, it doesn't have to be complicated. A simple cleanser in the morning, a sunscreen SPF 30 or higher every single day, and a moisturizer if your skin is dry. And then at nighttime, I really like a vitamin A derivative like a retinol. And it really can be that simple if you want. Make sure you're getting good advice from a dermatologist, not just taking your skincare advice from a celebrity or someone on TV or someone who is known for something else. Get it from a true skin expert. Make sure you're wearing your sunscreen every day, washing your face, and using a moisturizer.
How can we actually identify, if someone who sits at home right now, how do they know who is expert and who is not expert? And not everyone can reach to the doctor right away and make an appointment easy with dermatologist.
You're absolutely right. There's not enough dermatologists out there. And I find that a lot of people, especially younger people, are really getting their information from the internet, social media. And there are a lot of dermatologists nowadays out there putting out really, really good information. So if you are unsure, then what I'd recommend is make sure that they promote themselves, or on their website, it says that they are a board certified dermatologist. You want to make sure that you see all those words. Then you know that they've gone through the rigorous training of medical school and then dermatology residency, and they're really going to give you the best, most sound advice. And you just have to be careful when someone is giving you advice. Take a look back and see, are they trying to promote a product or sell me something, or are they truly just giving me factual advice? We have dermatology lectures and programs throughout the year here in Atlanta that really anyone can come to.
What was the most maybe funny or fascinated experience in your clinic that you share with us?
A patient came in for a skin check and they were worried about a spot that they thought was a tick. And of course, being in Boston, they were worried about Lyme disease. And so I was looking them over, and we use a special light called a dermatoscope. And when I went to identify the tick that they had, it turned out to actually be a little piece of food on them and not a tick at all. So we all had a little bit of a laugh over that. It was pretty funny. And then conversely, I've had it happen where they think it's just a mole, and I actually look at it with my light, and then I see the little feet, and I realize, nope, that's actually a tick.
And so before we conclude, Dr. Mina, can you share one advice with the audience?
I would say don't give up. If you really believe in something, go for it. My trajectory into medicine was totally convoluted and not what any college counselor would tell you to do. I was a ballet dancer. I danced straight out of high school, and medicine was not even a blip on my radar. And somehow I was able to change career paths and go to medical school, then become a dermatologist and a dermatologic surgeon. And I really just love what I do every single day. And if I had followed the advice of people who said, you can't do that, you're a dancer, you can't be a doctor, I'd never be here. And so if you really believe in something, go for it and do it, and don't let anyone tell you you can't.
Wow, that's absolutely fascinating. And especially for that reason, how is the audience can connect with you?
Absolutely. So I have a podcast called The Skin Reel, and I think you'll link that, or it's been on the ticker. And that is where you can come and you can listen to topics about skin related issues where I either discuss it myself or with a board certified dermatologist guest. And that's a great way to get really sound, reasonable skincare guidance. And if you're in the Atlanta area, you can also see me in my practice, Baucom and Mina Derm Surgery.
That's amazing. Thank you very much, Dr. Mina, for being on our show. And once again, everyone connect with Dr. Mary Alice Mina. And thank you so much for being with us today.
Thank you so much, Dr. Schaefer. It's my pleasure.
I met with a very special guest, Dr. Urquida de Rowan, a triple board certified family, diversity, and life medicine physician. She is a change maker in the field of healthcare innovation, committed to merging the human aspect of medicine with technology. Welcome, Dr. de Rowan. Such a pleasure having you on the show.
Thank you so much for having me.
Absolutely. So I know we met before and we discussed in such important topics. Can you please tell us first, before we dive in, a little bit about yourself?
Sure. Well, my name is Dr. Urquida de Rowan. I am a triple board certified family, lifestyle, and diversity medicine physician who lives in the DC area. And I'm super passionate about merging the human aspect of technology with healthcare. I am a healthcare technology consultant, and I'm also super passionate about preserving and promoting health equity. So I am also the founder of the Pacemakers, who's working to impact and change those social determinants of health.
Right now, it's so much information related to artificial intelligence, changing in medicine, message we send to medical trainees, community, physicians. Can you walk us through a little bit, where you started and how it brought you in where you are today, and how do we bridge the gap?
When I was in medical school at Boston University, I loved the underserved community ever since I grew up. A lot of my family is from inner city DC, so there are a lot of healthcare disparities, and I wanted to tackle those. So I decided to go to a very diverse medical school. So I went to Boston University, where I fell in love with family medicine, where it's all about storytelling and connecting with people from the cradle to the grave, because there's so much inequity in healthcare. So I signed up to work at the National Health Service Corps, and I went into community medicine at federally qualified health centers, and I saw so many patients who had so many needs where I would know what to do with them medically, but due to financial constraints or economic issues or not being able to get in for their appointments or not having insurance, there were so many barriers just from people getting basic care. AI and technology that you were mentioning can definitely be coupled with the knowledge that physicians and nurses and all of the healthcare workers have to bring people the care that they need right at their fingertips and give them access and expand it and expand the hours and expand the workforce and their capabilities and their capacities so that people can get the care that they deserve. And I think that it kind of goes down to the foundations of what we should expect from different specialties and different parts of the hospital system at large in general, because like you said, you'd expect one thing from your primary care and something completely different from your specialist or when you're in the hospital. And sometimes that's not communicated to the public. So I think that a lot of this onus on educating people about how the healthcare system works is on their primary providers and on different organizations, because we have to educate one. So that's why I'm working really diligently with the pacemakers to educate the populations about what's going on, how the healthcare system works, what happens when you go into a hospital system and you don't have insurance, but you still need to be seen. Just a day of utilizing technology where it was very impactful. For one person in particular, it was a woman about in her 50s who had been having a little shortness of breath here and there, some tinge of chest pain. And we used AI with that system, and they asked her a questionnaire of common questions. But this is the point where I always believe that technology should be used as an adjunct to healthcare. So reading that intake form, I was kind of prompted to ask more questions and to get more history from her. And I recommended that she go in person because of the things that she was speaking of. She checked in and we checked on her about a day or two later, and she had a pulmonary embolism. So healthcare technology is saving lives and bridging gaps.
What do you think was maybe epiphany or maybe funny or maybe embarrassing story that you had in your experience?
So I've had some really fun experiences throughout my career in medicine. I think, of course, there are lots of ways to connect virtually, but we always need that human touch. So I've definitely had some funny moments and stories or miscommunications with certain patients, but I think I'm going to take it back to when I was working in person. And I had a very lovely, I used to work in a federally qualified health center, like I mentioned, and one of my patients was a trans woman, super fabulous, lovely. I'm going to call her Miss Hallie because it's not a real name, HIPAA, but kind of Halle Berry-esque. She was fabulous. And as we got to know each other, like in the beginning, she was very shy around me, not really wanting to share a lot of information, but we built a bond and a relationship. She started to share her experiences in life because she was HIV positive and a sex worker. So sometimes when you hear those things, you may have preconceived notions. And I got to learn why that happened and all of those things. So eventually she started feeling comfortable. She brought her mom in for a visit and we were talking about things. And in the middle of the conversation, I like to change my hair up and things like that. So she just stopped me and she said, Dr. Jeroen, where'd you get that wig? And I was like, oh, you noticed it is a wig. So we stopped the visit. I went online and we went wig shopping in the office visit. And I was teaching her mom and her some tricks. So I think that was my most funny, revealing, but open moment with the patient. I was like, take these links down and look at this. So it was fun.
And for that, I would like to ask how the audience can connect with you.
If you have any questions about anything in terms of the pacemakers, if you want to get involved in the organization that's working to decrease social determinants of health and impact them via education, advocacy, and community building, definitely reach out to me. We're working in a lot of fronts. It's based off of my recent TEDx called Did Disney Just Save Healthcare? Imagine that. And it talks about how people from all walks of life can come together to impact healthcare and decrease disparities. We do everything from helping you create a business plan to helping you obtain funding. So if you're interested in that, feel free to reach out. And the way that Dr. Schaefer and I connected was through my podcast. I have a weekly podcast geared towards educating and mentoring pre-meds and medical students called The Perspective Doctor. If they have any questions, you can definitely reach out on my website. It has a contact us, or on my Instagram. I'm definitely there at Dr. DOCTOR, the letter D, GRAM, Dr. D Graham. It was so lovely to be here.
Oh, Dr. Rowan, thank you so much. It has been so amazing to have you as a guest. And thank you very much for everything you do and provide so much care and so much value. And I can't wait to connect again. So thank you.
Thank you.
Earlier, I met with a very special guest, Dr. Diana Londono, a board-certified urologist and one of the 10% of urologists in the US who is woman, and 0.5% that are Latinx and a woman. She specializes in diagnosing and treating non-surgical and surgical disorders of the kidney, bladder, urethra, prostate, and male reproductive organs. After personal burnout, she became a certified life coach and founder of Physician Coach Support, discussing topics such as wellness, boundaries, ego, humanity in medicine, mindset, and mindfulness. Hi, Dr. Londono. Thank you so much for joining us today.
Thank you for having me. I'm so glad to be here and have, an important conversation today with you. Thank you. I'm a urologist in Los Angeles. I'm board certified as a general urologist, but I also am very passionate about physician wellness, burnout. I'm the founder of a platform called physiciancoachsupport.com. And this is a platform that is free for any physician to come. And what happens here is they basically look at their schedule, their time zone, and they can pick a time and a date where they can make an appointment via Zoom, and it's confidential, and they can speak to a physician who is also a life coach. And you can bring up any topic, any challenge, any feeling, any situation that they want to discuss.
So, what was the most difficult situation you encounter during all this time? Can you give us maybe as an example, kind of scary situation?
Well, absolutely. I mean, I think the most difficult or challenging was my own burnout. And I'm saying that because, again, sometimes it has to be pointed out. We don't have the self-awareness that this is happening. And when I was going through burnout, it really had to be pointed out by my husband. And it took me a whole year of having, physical manifestations of the chronic stress. So I felt a lot of things in my body. I couldn't sleep. I was grinding my teeth and I destroyed my molars, and I got an abscess from, grinding my teeth. And this is all from stress. I developed reflux and I had to be on Protonics. I, had asthma at 42 years old, and I had chest pain. I had joint pain, basically like autoimmune disease. My rheumatoid factor was elevated. So my body was literally attacking itself, from this chronic stress. So, I went to different specialists and rheumatologists and the cardiologist and had an echo and all these tests to really figure out what it was. And of course, everything comes back normal. And it's not, it's chronic stress. And so when you have that awareness of what's going on, if you name it, you can tame it. So sometimes you have to realize I am in burnout, or I'm just feeling apathetic, or I'm feeling depressed. And then what am I going to do about it? So it was definitely a challenge to figure out what it was, learn about it, start my journey about learning about wellness and burnout and stress and what we can do to get out of that.
Thank you, Dr. Landona. You share such a vulnerable story, and a lot of people, a lot of physicians will actually learn from it, because you're also so brave that you came and you actually spoke about it. And there's so many, probably thousands of physicians that would not even admit those symptoms that they have right now. And it's a lot of things that I also have seen that organizations and large institutions, being in the corporate ladder, if you admit that you have those symptoms, obviously it's also obstacle in promotion, it's obstacle in the leadership, it's obstacle in so many things. And for us to advocate for each other, I think it's really going to help tremendously in the healthcare and have even breakthrough in healthcare system. So thank you for that. I also have another question. What maybe the most fascinated or maybe funny experience or maybe embarrassing experience that you had during all this time?
Yeah, I mean, I think, like I said, it's sort of the two sides of the coin. I mean, it's to me fascinating, and it's just really, I'm just grateful for this experience, because without having gone through it, I wouldn't have learned about all this, which is so important and is affecting so many of our colleagues. And I also wouldn't have made these amazing friendships and connections with you, with so many physicians and colleagues that are really in a journey that is similar, or they're advocating for, mental health or wellness, or maybe are out of that space, but are really helping, to promote and elevate and to raise our voice like you are. So I'm just really grateful for that. I can't say that enough, that it's worth every minute of pain and discomfort and all the things that I had, because I think that the fruits of it are so, so important. So yeah, I'm just grateful for you, your platform, and for all the people I've met and that really have, helped us throughout, this whole journey, and all the volunteers that are there that supported this idea, this mission. I can't do it without all the volunteers. I'm just really grateful to them and to people like you. So thank you. It's really important, because I hope that when people hear this message over and over, they will make some change. They will think about things a little bit differently, and it will just click that it's time to do something differently for themselves and to take care of themselves, and how it's so important. So if this stuff resonates, please reach out to me. You can go to my website, Diana Londoño, MD, medicaldoctor.com, or on any social media platform under the same name, Diana Londoño MD, LinkedIn, Facebook, Instagram. I'm passionate because it really has such a big effect and ripple effect in all the lives that we touch as physicians.
Thank you. Thank you very much, Dr. Landona. I really, really enjoy, and I strongly encourage audience connect with you. And hopefully we will come back and we discover and we talk more to more physicians and advocate and have so many valuable points.
Thank you again. I really appreciate the platform and everything you're doing and just really trying to elevate and amplify this message. And again, hopefully reaches that person that has to hear it and will make it change and really take care of themselves. So thank you again as well.
Thank you for being with us on the Dr. Connect show. Do you have a story, a question, or an idea? Go to the website, thedoctorconnect.com, and click the button, Show Me How, and let us help you to share your expertise or experience. And follow us on social media. Check out the book, The Other Side of Oncology, and join and subscribe our YouTube channel, The Dr. Connect. We are super excited to have you on this journey with us. And thank you for watching and listening. And we are looking forward to seeing you in the next one.